Good morning, East Texas. I'm Sarah Miller, and this is your morning news update. Tyler police have captured one of two men suspected for an early morning convenience store robbery in Tyler. The police are actively searching for the second suspect. Two men approached a store clerk of a convenience store at Old Ullman Road and spurred 248 and forced the clerk back into the store at gunpoint. The suspects took an unspecified amount of money from the store. A customer drove up and scared the suspects, causing them to flee into the woods. While making the escape, one suspect shot himself in the leg. The injured suspect hid in a nearby bush and was later apprehended by Tyler police. The second suspect is still on the loose. More information will be on tylerpaper.com when it's available. It turns out that a man who claimed he lost and then found his beloved service dog earlier this month was in fact trying to run a scam and lied to various people, according to Jacksonville police. Charles Booth, 54, told media and others last week that he was reunited with his dog after the canine went missing for days. At the time, he was living behind a building in Jacksonville, and police confirmed they knew where he was staying. Booth was arrested Friday and charged with public intoxication, a Class C misdemeanor, and fraudulent use of identifying information, a state jail felony. Police said Booth also possessed another person's birth certificate, but they are not sure why he had it. The University of Texas at Tyler is seeking women to participate in an exercise class and research study for cancer survivors. Participants must be 55 years or older, must have completed cancer treatment in the past 2 years, and must be able to walk. A mandatory orientation session will be at 9:30 a.m. January 26th in the UT Tyler Harrington Patriot Center. Physician screening forms will be distributed. Each cancer survivor will be paired with a kinesiology student who will act as a personal trainer. The 8-week morning classes will be on Tuesdays and Thursdays beginning February 26th. For more information, contact Dr. Ballard at 903-566-7042. Lieutenant Governor David Dewhurst and a Dallas area state senator plan on a joint news conference to reveal two Medicaid reform bills. The pair will discuss Texas Senate Bills 7 and 8 this morning. Jane Nelson is a veteran Republican from Flower Mound. She is sponsoring a bill to require those seeking welfare and unemployment benefits to undergo drug testing, an initiative supported by Dewhurst and Governor Rick Perry. Dewhurst ran unsuccessfully last year for U.S. Senate. He was defeated in the Republican primary by Ted Cruz. Dewhurst returned to the Texas Capitol vowing to ensure that the Republican-controlled legislature adheres to even more strictly conservative values. Lance Armstrong may not be done confessing. His interview with Oprah Winfrey hasn't aired yet, but already some people who want to hear more under oath before Armstrong is allowed to compete in elite triathlons, a sport he returned to after retiring from cycling in 2011. In addition to stripping him of all 7 of his Tour de France titles last year, anti-doping officials banned Armstrong for life from sanctioned events. World Anti-Doping Agency officials said nothing short of a full confession under oath would even cause them to reconsider the ban. Although Armstrong admitted to Winfrey on Monday that he used performance-enhancing drugs, they said that it is hardly the same as giving evidence of relevant authority. A new government survey suggests the number of people seeking emergency treatment after consuming energy drinks has doubled nationwide during the past 4 years, the same period in which the supercharged drink industry has surged in popularity in convenience stores, bars, and on college campuses. From 2007 to 2011, the government estimates the number of emergency room visits involving the neon-labeled beverages shot up from about 10,000 to more than 20,000. Most of those cases involve teens or young adults, according to a survey of the nation's hospitals. The report doesn't specify which symptoms brought people to the emergency room, but calls energy drink consumption a rising public health problem that can cause insomnia, nervousness, headache, fast heartbeat, and seizures that are severe enough to require emergency care. Several emergency physicians said they had seen a clear uptick in the number of patients suffering from irregular heartbeats, anxiety, and heart attacks who said they had recently downed an energy drink. More than half of the patients considered in the survey who wound up in the emergency room told doctors they had downed only energy drinks. That's all for now. Check back throughout the day here at tylerpaper.com for more news updates. Have a great day.